Now, moving on to our first section, that is preparation for an orthopedic surgery. As you know, that orthopedic surgery deals with musculoskeletal disorders. This could be congenital problems such as the developmental dysplasias of hip, leg Carpathy disease, or even slipped capitofemoral epiphysis. This could be treated with trauma such as dislocations of the fracture, broken femur fracture, tibia fracture, radius and ulnar fractures. So to prepare for the adequate surgical treatment of the patient, certain things which need to be done beforehand. For example, the most important in the pre-operative planning is our preparation is actually the X-rays. This is a very basic modality which is an adjunct to history and examination. Of course, history and examination and mechanisms of injury and actually what are associated findings are the most important thing. These are the cornerstones for any doctor. But for an orthopedic surgeon, he has to confirm his or her finding by use of X-rays. And if you see this X-ray, actually this is an AP view and this is the lateral view. You usually require two views. Why we actually require two views is because if you see it on an AP view, you can appreciate probably there is a bullet inside the knee joint and there's a bullet fragment over there, but you cannot appreciate the depth on one view. On AP view, you're sure that it's inside the knee, but you're not sure whether it's actually anterior aspect of the knee, it's in the center of the knee, or it has traversed a whole compartment and gone actually into the posterior part of the capsule of the knee. If you see the lateral radiograph, that is where you actually realize that, okay, it has gone in, but it's actually reached the center of the joint. It has not gone into the posterior part. So that is why you need two views, so that we can actually plan properly and we are sure about our depth perception that, okay, this is the fracture geometry on one view and this is the fracture geometry on the lateral view. On AP view, this appears to be valgus or varus tilted, and on lateral view, this appears to be anterior, posterior, dorsal or plantar tilted. So that is how we can appreciate different bone fragments, and we need two views for that. As I told you, it needs careful planning of the operations. Whether we, first of all, the most important thing is what is the diagnosis and do we need surgery for this or not. For example, in this case, if there is a bullet inside the joint, this is going to be a highly problematic for the patient. Patient will not be able to bear weight. There will be increased lent synovitis and may eventually lead to septic arthritis. So to protect the patient from all those sequelae, we need to perform surgery in this case and take the bullet out. As you know, that bones comparison for the symmetry with side of other axis and the opposite limb. This is especially true in case of the children bones. When even all the x-rays is normal and there's usually sometimes a physeal injury, we are not really sure because physis is actually not visible on the x-ray. What is visible on the x-ray is actually the mature bone. So what happens is sometimes we have to get the x-ray of other limb, especially in case if we are suspecting a supracondylar fracture in a child and there may be an occult fracture type and we are still not sure, we may have to get an x-ray of other side to rule out whether there probably is the bony deformity which we are doing, is it an occult fracture or it is actually how the child's bones are made of. That is where sometimes you need the x-rays of the other limb as well. Usually what you need is an x-ray, AP and lateral view of the same joint. Two views are required so that we can make a 3D image of the deformity or the problem which is we are facing. Then techniques usually employed are, as I told you, X-rays and ultrasound. Ultrasound is rarely done, but for if we are suspecting some kind of effusion in the joint or if there is actually a swelling and maybe we are suspecting some kind of infection, yes, ultrasound has a value because this pocket of pus which may be localized, this can be actually aspirated by use of an ultrasound. Other options, if we are stuck with X-rays are normal, then what other options we have? For example, if a patient who has a history of is a sportsman or he's from army recruit and there he is complaining of actually knee pain or ankle pain or even shin pain and he is suspecting stress fracture, now x-ray of a stress fracture would be completely normal. So you cannot, even if you get an AP or lateral view of a patient's tibia, those both views would be absolutely normal. So we may have to proceed to another thing like MRI. Similar is the case with the tumors. when we know is like even the bone tumors such as osteosarcoma or even the Ewing sarcoma, even the soft tissue tumors, sometimes we need to know the soft tissue extent of those masses. Therefore, we have to go for MRI. Other options is that like CT scan. For example, we are not exactly sure whether this is osteomyelitis or whether this is Ewing sarcoma. Sometimes we have to go for a modality other than X-ray as well to make it sure whether this is a bony pathology or it is something which is not associated with the bone. Other options could be transparent templating and digital templating softwares. Nowadays, especially as with advancements of surgery like total knee arthroplasty, total hip arthroplasty, these techniques are coming up because this actually helps a surgeon to accurately manage the deformity without creating a lot of problems for the patient post-operatively. Other planning which we need to do is, for example, if this is a case of open wedge osteotomy probably done for genovarum. But what happens is we have to plan whether the deformity is varum or valgum, and then whether we need to do an open wedge or a closed wedge osteotomy, and if we do want to go with where we want to do for the open wedge or the closed wedge. Therefore, that is actually pre-operatively has to be decided so that the minimal blood loss and minimal time is actually taken for the surgery to perform. Other important is implant positioning. Especially we have to take care in terms of an orthopedic surgeons does actually do take care as well that these screws and plates are actually not going intra-articularly, because screws going into the joint could be disastrous for the patient post-operatively. Not only that will delay the weight bearing, but also will lead to cartilage destruction. Then templating softwares are actually now readily being used in TKR, that is total knee replacements and surgeries, and even total hip replacements as well as shoulder replacements. Why? Because every knee or hip has a slightly different biomechanics, and so actually you cannot have a template design specifically for that kind of a patient. So what it is actually measures the different landmarks on the native knee, and kind of the software is actually utilized to make a customized implant for that kind of a patient. Other option is rehearsing using an artificial bone. Yes, that would actually help, because saw bones have been used actually in form of research for better training and for the different workshops for the better training of the residents, which would be eventually the future orthopedic surgeons. Then options has been limited, although its use is limited, but yes, it is coming up now, is the 3D printing models and mock implants, which can be actually used to perform a mock surgery on a cadaveric patient. Other equipments which actually been utilized by the orthopedic surgeon include drills, which is actually for making a hole in the bone, which actually utilizes a different drill, actually utilizes drill bits, which could be of varying sizes, and varying sizes of the holes can be made. Then it's the osteotomes, which are actually used to cutting of the cancellous bone. Actually, when we are performing osteotomy in a cancellous bone, it's actually spongy, so an osteotome can be used to cut it. Otherwise, if you are making an osteotomy in a cortical bone which is thick and strong, therefore we may need electrical saws. There could be hand saws as well, but different nowadays electrical saws coming up which can be used for the cutting of cortical bone. Chisels has been rongers, chisels, and different instruments have been utilized actually for shaping of the bone, so that there is no bony spur which can later on damage the soft tissue such as tendons and nerves and etc. Then there could be use of gouges. This is for the removing of the bone or for the curate of any material which is like pus or anything, and necrotic bone which could be residing in the intramedullary cavity. Plates and screws are used actually for the fixing the bone when we are doing the osteosynthesis of the bone in form of plates. We can use plates and screws, so screws can be inserted by use of screwdrivers. Other equipment includes, there is now actually depending upon what kind of surgery is required. For example, this is the diagram which is showing the total hip replacement. Now it requires a lot of instrumentation. There is a lot of new instrumentation, different type of retractors are needed, even different element, because sometimes some surgeons prefer to go through a posterior approach, some are going through the anterolateral approach. Depending upon what approach is used, different structures are required. And then yes, as we know, there's this femoral stem reaming has to be done as well in the proximal femur, use of cementation. And then with cement, no, there are multiple modes of cementation as well. This could be with thumb or hand, or this could be with vacuum assisted cementation, which is now being actually introduced, so that even proper laying of the cement is being done in these instruments. Therefore, actually, as the techniques are evolving, as the technology is evolving, that is actually becoming increasingly technical and increasingly sophisticated and complicated. Therefore, more specialized implants instruments needed, for example, in case of joint replacement and spinal fusion. A surgeon needs to be familiarized with these techniques. They need to have enough hands-on experience as well. They may have assisted certain number of cases, then may have performed those cases under supervision. Then actually there are certain cases have actually a longer learning curve as compared to other. Thank you very much. Keep watching sqadia.com.